Good morning, ladies and gentlemen. We're off on the last session. The last session, Plenary 4, is called From Political Declaration to Real Action. And we have a very good group of survivors from the conference here. We've heard some really interesting and important recommendations from the first session this morning. And the question is now, so what? The session is going to focus on practical actions that will accelerate progress on UHC. No more talk about challenges. It's about how we're going to make progress, the implementation aspect. We saw a very nice slide reminding us it's a long and winding road uphill in the previous session. Let me just outline how the session is going to work. We've got a very distinguished panel, and we will do some brief introductions. We will then get a quick sense of who among you, the survivors, are still here using this Mentis app that we used yesterday. We're going to quickly see who's here from what organization and how old we all are, to see how it balances out with the slide that was shown in this morning's presentation. We'll then hear some thoughts from the panelists who represent different constituencies, and you heard the question asked just now about how do we get these different stakeholders to work together. And we've got people from foreign affairs, from finance and health, and the scientific community on this platform, and many more constituencies in the audience. And then we're going to make you work, and we're going to use the Mentis app again, and we're going to ask you 3 lots of questions, and I'll explain that later. And then finally we'll go back to the panel. So we've got about an hour, a bit more than an hour if we need it, and let's kick off now. First of all, the introductions. May I ask the panelists to briefly introduce themselves? May I start with His Excellency, the Ambassador from Thailand?
Good morning. I hope that everyone is in a good health in Bangkok. My name is Vitavas Srivihok. I'm the Ambassador and Permanent Representative to the United Nations.
Good morning. I'm Chieko Ikeda. I'm a head of one of the regional offices of Japanese Ministry of Health.
Good morning, everybody. My name is Mark Blecher. I'm Chief Director Health and Social Services in the Ministry of Finance, South Africa.
Good morning. My name is Kaha Imnadze. I'm Georgia's ambassador and permanent representative to United Nations.
Thank you so much. So all our mics are working as well, which is a good. Now I want you to introduce yourselves. Fadi, it looks like we're ready. You've got the app here. Can we have the first question? Okay, mix of audience. We showed it was 47% female in the slide in the previous section. Amongst the survivors, can you start filling in who you are? We'll see whether the balance of survivors is similar. Okay. Pretty similar, I would say. So we've still got a pretty good representation. Can we now move to the second question? Which organization do you belong to? Sorry, there's quite a lot of ones here, but what we want to get a sense of is your primary affiliation. Are you public sector from a low middle income country? You can read them. We're getting very slick at this. I love these bubbles. So, 2 biggest groups, academic institutions and international agencies, but still a good share from NGOs and from the public sector. Very good. Okay, it's good something to remember. Right, next slide, last one. Okay, who's over 30 and who's under 30? Or 35, it's been put. We've wanted to make it look slightly better by saying 35. Some people must still be in bed. Okay, anyway, so we've got a good idea of who's in the audience, and it will help us as the panel as they talk. Thank you very much. Well done. Now we turn to the panel. But first, I was asked to give a quick recap about the UN General Assembly Declaration on UHC. Now, I'm not going to do this in detail, I can assure you, because there's 83 paragraphs in the document, of which 60 are about actions. But I just wanted to note a couple of things. We've already heard multiple times through the conference that there has been progress on UHC, but not fast enough. The declaration itself has an aim of 1 billion more people with quality essential services and to stop and reverse the trend in catastrophic spending by 2023. That's the halfway point. So those things we've heard before already. What's really emphasized in the declaration is about moving together to build a healthier world. And we heard a bit about that in the last section. So it's an important theme we're coming back to. In terms of action points, in the declaration, there's a paragraph, I think it's paragraph 82, which is there will be a progress report to the UN General Assembly in 2023. That's only 3 years away. So we've got that global perspective on follow-up. The rest of this session is going to be, so what are we ourselves doing to contribute to making that progress? So when we meet again in 2023, we can see faster progress than has been the case up until now. So I'm going to turn to the panel, and I'm going to turn to the two ambassadors here who heroically, in my view, co-facilitated the UN General Assembly high-level meeting process. And I'm going to ask, first of all, Ambassador Kaha Imnadze from Georgia, the following question. Looking back, can you reflect a bit on the political process of reaching agreement on that declaration and who was involved? What were the critical factors that really got you there? And you have 3 minutes, sir.
Thank you. This is the last thing I want to remember everything, because that was really a very difficult process. But in my 30 years of career, probably the most meaningful thing I've done was that facilitation, given the impact that it can possibly have on world community. Now, we worked, every nation was very much engaged, and one has to understand that United Nations, it's a vehicle with 193 wheels, and all of them are in different gear. And to come to a consensus, it is always very difficult. However, UN has tremendous convening power, and when we have a political declaration, when all the nations declare at the heads of government and heads of state level their political will, representing the will of their nations, of the society, I mean, this is a very powerful tool to move ahead. Throughout the process, I would say this political declaration is a great declaration. You mentioned several key points there, but from the very beginning, this is the first time that we actually say that UHC is its precondition, outcome, and indicator for sustainable development. And that's a very important message that is in the very first paragraph. Now, talking about 83 paragraphs, it was much less when we initially drafted it together with the great team that we had, including Werner Obermeier, that sits right in front of me from WHO. And probably the first draft was, maybe Vitavas would agree, the first draft was the one that we loved most. But of course, throughout the process, you get a lot of inputs, a lot of political pressure from various constituencies in various countries, which is normal because it is a political process. But at the end of the day, we managed to put together quite an ambitious agenda for all of us. I mean, you mentioned about 1% of GDP. We wanted initially to be even high, to be 5%. But that's even the fact that every UN resolution has more of a recommendation character rather than obligatory. That was very difficult to put through for many objective reasons. So The political process was not easy because of that, but I must say that all the key groups at the end of the day, and we pushed it to virtually to the limits because we had to break the session. It was already August, and just before few hours of the adoption of the political declaration, we were still working, making sure that everybody was on board and nobody would duck the last moment.
And I know there were many, many meetings of different civil society consultations leading up to it, and meetings in different regions as well. So more and more inclusive, I think, than
well, you mentioned so what as the beginning of, I would say, so how it started. It started with the civil society. The key asks that, that were given to the General Assembly, the very first meeting, where it was mostly the civil society.
I'm sure we've got people in the audience who are part of those developing those kiosks. But let me now turn to Ambassador Vitavas, Srivihok. Looking forward, so we've looked back a bit. Now, looking forward, how is this declaration being translated into action through foreign affairs channels? You're an ambassador. What are some of the upcoming relevant opportunities, either at global or regional level, in your view?
Let me first add something to my dear colleague, Ambassador Kaha. 2 years ago, when we were appointed as the co-facilitator in this political process, we admitted, but for myself, it is a big surprise. Because in my life, it's only one aspect that I involve with the issue of health. Is as the patient. I never know anything about the health issue, but I admit to be the co-facilitator because we would like to translate the document of the United Nations to the benefit of the people on the ground. This is the big challenge of the United Nations today, that it is really difficult to explain to the people outside the UN to understand what we are doing right now. So this today is a very good opportunity that we're going to tell you about the very difficult, one of the most difficult process. First, this declaration is the first ever political declaration on universal health coverage. Never before in the history of the United Nations. This is the first time. And this is a very long one. And during the course of negotiation, I and Ambassador Kaha repeat to the colleague around the room many times that as the co-facilitator, we're not going to negotiate with the member state. We're going to facilitate the process. So don't negotiate with the co-facilitator. It is not my document. I told the colleague, it is not your document, but it is our document. People outside the UN around the world still waiting for the effective implementation of this kind of document. That is the main reason why both of us accept to be the co-facilitator in this process. Back to your question about the way forward. I think the most important thing, political declaration is mean that you have to involve with the high level political circle in your country. It's like that's why when they organize the high level meeting at the United Nations, they invite the highest level to attend to make the political momentum. I think political momentum is the one of the most important factor that going to move this declaration forward. Otherwise, in the next 3 years that we come back to review the progress, it's going to be like so many other documents of the UN that nothing happened. Nothing happened, but we still have the same document here. And when we look at the review, it's really a little progress. So my answer is keep moving together. Keep moving together to build a healthier world. That is very important for the way forward.
Thank you very much. Are there any major events coming up in the next year where you as in your role as ambassador, you will be participating in regionally or globally, where you can keep this movement going through your own efforts?
My homework here at home is we have to connect with the high-level policymaker, with the parliamentarian, with the people on the ground. So we have to translate the political aspiration and declaration into the real action. There are so many factors that involve as the key success factor. Let me mention some main factor. The first one is sorry, I have to see the reminder. I have a problem with my memory.
So do we all.
Yeah. Okay. To move the political declaration to the action, there are at least six key success factors. The first one is the universal health coverage political declaration. There is no one-size-fits-all. This is very important. You have to adjust to your national context and your priorities at home. This is not one-size-fits-all. It's like the all you can eat. It's not like all you can eat, but it's you all can eat. Not all you can eat. So not one size fits out. This is very important. So we need the national ownership and the policy innovation. That's the key success factor. The second one is the USD. That's why USD is the political choice. We need a political leadership beyond the health sector that many speakers repeated many times, beyond the health sector. How can we translate this political declaration to pursue the whole of government and whole of society approaches, as well as health in all policy approach? This one is another key success factor. We have to inject all the elements of health into every policy at the national level. The third key success factor is the role of the parliament. It's important. We need an enabling legislative framework. And the fourth one, as many speakers emphasized, the role of the primary health care is needed. And we look at the primary health care not only as the preventive measure, but it's the prerequisite to the success of the universal health coverage. The fifth one is that we need the efficient health financing policy. Without the efficient health financing policy, we cannot implement anything. And the sixth, not the last one, we need adequate health infrastructure and workforces. And this is very important. We lack so many, I think, million health workforces around the world. This is
Thank you.
For the beginning, first round.
Exactly. Okay, well, we'll come back towards the end. So we've heard it said very clearly by the ambassadors, we mustn't leave this document on the shelf. And that's been a theme of the meeting as well. Okay, so now we're going to turn to two colleagues from different sectors in government. Mark's from South Africa and Chieko is from Japan. 3 minutes. Mark first. Mark's from the Treasury in South Africa. From your perspective, what do you think are the most important actions going forward for ministries of finance, from your own experience or others? Over to you.
Okay, thank you, and good morning again to everybody. So I've been asked to speak specifically from the focus of the Ministry of Finance. Noting high levels of out-of-pocket expenditure in many countries, we saw in the WHO spend data released again in December that spending through out-of-pocket payments still exceeds government spending in low-income countries. It's essential to build public financing streams for health. In South Africa specifically, private financing still exceeds public financing, And this partly underpins proposals under national health insurance to progressively grow public financing from 4 to 6.2% of GDP over a 15-year period. But ministries of finance do not allocate funds without strong evidence of performance from existing spending and also well-developed and sensible implementation plans, which again emphasizes the technical aspects of this. Such as to extend coverage, for example, around 1990. In our case, we still need to introduce hepatitis C treatment, interventions to continue to reduce child mortality and address an exploding burden of chronic diseases and mental health. Now, the relationships between ministries of finance and ministries of health don't occur only at the political level, but also at the technical level. And it's essential in all countries that there are regular structured engagements around the budget process and around implementation of policy programs. We're already clearly some years beyond the political declaration, and we need to accelerate beyond policy into a period of implementation, where those with strong implementation skills are able to run with a ball. For example, in our case, we need to appoint a strong person to lead and build a team to set up the early parts of our National Health Insurance Fund while continuing to build implementation capacity and systems. Our National Health Insurance Bill is currently in Parliament, and once passed, it will lead to many changes. For countries such as South Africa, which have decided to implement a purchaser-provider split, we need to see some practical application of strategic purchasing, for example, using public funds for example, purchase services from GPs, general practitioners, and funding for this has already been set aside, in addition to use of public clinics and the building of an efficient NHI fund. In our country, the development of a mixed service delivery platform that's public and private has specific relevance because existing taxpayers who will significantly fund the national health insurance system currently rely extensively on private sector for provision, and bringing them into a universal system requires a building of trust in the universal system. Public services equally need strengthening and quality improvement in many dimensions. Given the existing coronavirus outbreak, we need to continue to support global health security, and noting the inputs of the 2 PMAC laureates around great scientific developments in the fields of hepatitis C and trachoma eradication, we need to continue to support research and scientific advances. Noting also that many of our great challenges of our age involve complex multi-sectoral problems around development, environmental factors such as air pollution and clean water. We need to support multi-sectoral intervention strategies. Thank you.
Thanks very much, Mark. So a couple of comments before we move to Chieko. First is that, Mark's made the very clear point, moving from political to technical actions. You can't do just one or the other. And he's given some very nice examples that have also come up in the conference of some of those things where the Treasury is heavily involved and what's actually beginning in South Africa, or well underway in some cases. So moving on now to the health sector, Chieko, we've heard a lot in this meeting about functioning frontline services, primary care, and the associated health workforce medicines, etc. inputs. From your perspective, your experience in Japan and elsewhere, what are some of the most important actions going forward? Over to you.
Okay. Thank you, Phyllida. As you know, that Japan had made a political choice to invest in the health 60 years ago. But after that, since then, that we have been trying to adjust the system to meet the current issues, such as the super aging society. And sometimes it worked, and to be honest, sometimes it didn't work. Ministry of Finance is not always our best friend, but we have keep communicate each other. And last year we had a kind of a big wedding ceremony at the occasion of the G20 summit in Osaka, which produced a shared understanding by the G20 finance and the health ministers on UHC. And now we are facing challenges related to super aging society. And first, we know that the political commitment is essential. And now in Japan, the Prime Minister Abe's one of the top priorities is social security policy reform. Why? with the support of the Ministry of Finance, that he clearly understands that we have to combat with the super aging society. And at the same time, most of the Japanese people clearly realize that this is the issue because we can show the evidence. Next step would be building policies. And in order to deal with the super aging society, we need to make the health system more efficient using technology and the capacity building of human resources. And the government introduced a comprehensive system at the community level that provides appropriate living arrangement for the elderly, including housing, healthcare, and social care services. Learning from what we have experienced in the past and from other countries' experience, we are trying to build policies now based on the people's voices from all stakeholders, private and public, young and old, and caregivers and patients. Thirdly, we need to implement policies, and like 60 years ago, probably local governments will play a big role. At the same time, we need to involve local communities, including civil societies, volunteers, and healthcare providers. Strengthening local governments and empowerment of human resources in the community would be the key for implementing policies. UHC is not a goal, we have to maintain it. When thinking about the sustainability of the healthcare system, we need to acknowledge that each country has a different stage. So we should create our own original system. We can't copy other countries' system, but we can learn from each other. Thank you.
Thanks very much, Chieko. Okay, so in this session, unfortunately for you, I'm wearing two hats. Dr. Vera asked me also to speak a little bit from the scientific community's perspective on how health systems and policy research contributes to UHC, its design, its implementation, and its evaluation. So I'm going to be extremely brief on this because there are many more people in the audience from the scientific community, but let me just give a very few reflections before I turn to the floor. And my short answer to this question of how does it contribute is not as much as researchers would like. Not least because policymakers have their own knowledge and multiple influences on decisions, but also to some extent because there are issues on the research side. And we know this is not a new issue. I've been hearing about it in the 25 years I've been in public health. So what I'm going to try and reflect on, and I've got 3 or 4 points, is anything changing to increase the contributions of research to UHC? Research has a variety of uses, from identifying new issues, hot topics, of identifying solutions, and tracking progress. And a few comments on the volume of research. The volume of research is growing, but I would say it's still relatively more from northern institutions. There's broadly more research on financing than on service delivery. There's more on what to do, the design or proof of concept, than on how to implement, especially at scale. And we're hearing a lot about that in this meeting. And research on governance is still very scarce. That's on the sort of types of research that's going on. And lastly, a few comments on how do we increase the contribution of research to policy. I've come across a lot of efforts where researchers are trying to increase the relevance and ownership by engaging policymakers in identifying priorities, and in some cases, engaging them in the whole research cycle. There are collaborative platforms. We had a session on observatories here that bring together policymakers and researchers, the Asia-Pacific Observatory, the European Observatory, for example. And there's lots of examples of embedded implementation research beginning to emerge. In fact, it's become its own research topic. But addressing the things that policymakers are fretting about will certainly contribute to increasing the use of research. The second issue is around timing, and for researchers to be ready to work fast to meet a short window of opportunity. And another thing to consider is giving real-time feedback during research, if that's possible. You don't wait till the end of a 2-year research process. See whether it's possible to have dialogue with preliminary findings on the way. And the third major point I want to bring up is the language and the type of product that comes out of the research. It's a real challenge, and my experience is that neither policy briefs nor publications are sufficient on their own. You have to have messages that are framed around policymakers concerned, like how many people is this going to benefit from your findings? What's the budget impact? These really, really matter, and it's so striking. I was in a session about HTA. How do you frame the findings of HTA so it really, the health technology assessments, it really resonates with the policymakers' concerns of the day? Those are the three main things. A couple of others: sharing evidence with others, not just with policymakers, civil society, and all the different forums that can actually demand action may help increase research. And I think that's sufficient for now, but just to give you a flavor of what people are trying to do in the research community to try and increase their contribution to the accelerating UHC agenda. So with that, it's now time for work. And I'm going to ask Fadi to put up the first of 3 questions we're going to ask you, the audience, to vote on. And then I'm going to give you a little bit of a surprise about how we're going to get your input. So can we have the very first question to you, the audience, which is, I can't read it. Can you read it? Start voting on, in the next 2 years, do you think your country can or will make significant progress on improving service coverage? Okay, so it's kind of 50-50. So let's be positive at this one. There's half the room, and an awful lot of people are standing. I was going to ask all the people saying yes to stand up, but we'd get a bias because half the audience here is already standing. Can you put up your hands if those of you who think we will make progress? And I'm going to ask a couple of you to go to the mic and say how you think that progress is going to be made. We want some concrete actions, examples of how we're going to move. So hands up. Who said yes? Hands up, hands up. I'm trying to see. I can't really see people very well. Okay. Who's here amongst those hands that were put up? Who was from public sector in a low and middle income country? Hands up. Okay. Now there's very keen people over here. Okay. Would one of you like to come and have a microphone or go to that? There's a microphone here. Say how in the next 2 years you're going to make progress on service coverage. Thank you. And say who you are.
Yes, good morning. My name is Esther Pessaries. I'm a member of Parliament in Nairobi, Kenya, and a member of the Health Committee. Well, Kenya has got UHC as one of its agendas. We are partnering with almost every country that we can. We've just entered into a partnership with the UK to try and actually enhance our first university hospital that we've opened, Kenyatta University Hospital. We've got a national hospital insurance cover. We're trying to sensitize people. We've got a maternal program. We're putting money into health. And the idea of getting members of parliament involved in programs like this puts us on the forefront of talking with the world and learning from other people's best practices. So I believe that it's an expensive exercise. The only thing that I feel we are challenged is that we don't look at the HR component. HR is such an important component. We don't look into it enough. It should be focused on. We have doctors and nurses striking because of not enough pay, not enough commodities, and you cannot achieve UHC without involving the human rights, the human resources component in delivering and accelerating progress towards UHC. So I feel that that's a neglected area, and you cannot do it without the human resource element. So that's an area that I want to focus on, ensuring that the human resource element, and then also understanding that most poor people in Kenya cannot afford the $5 premium that we put a month for the entire family, which averages 5 children. They say we can't afford it, we can't afford to eat, we can't afford the $5. So how do we get the rich to take responsibility for the poor so that we don't leave them behind? So that will be another area. Thank you very much.
Thank you very much, and very important, the emphasis on human resources. But very good to hear from Kenya about what they're specifically doing. Another person, who else put their hands up? I can't, now you've all put your hands down, I can't see. Who else would like to say how they are going to achieve acceleration in UHC? Maybe someone, anyone else? Anyone working on human resources, doing something big on the human resources agenda? Oh, good. Yes, please speak. And say who you are, please.
Thank you very much. I'm Lydia, the Chief Executive of the National Health Insurance Authority in Ghana. In Ghana, we're using the health insurance as an accelerator towards UHC. We're partnering with the Ghana Health Service to ensure we have these, what we call CHIPS, Community Health Planning Services, but they work in provider networks to ensure the services reach the last mile. We're using our health insurance to ensure we cover the informal sector and the poor. 65% of our population are exempt from premiums. We have special rates for pregnant women are totally free. We work with the Department of Social Welfare to capture the indigents who are also free. Currently, we've reached 42% of the population who are actively covered. So it's a matter of working around the population coverage, service delivery, and the financial risk protection. And we've seen remarkable improvement in the last 3 or 4 years. The provider networks, which ensures the comprehensive package is at the last mile. We've piloted in 4 districts. They have recorded no maternal deaths in the last year in those 4 districts. So we have things that are working, and it's a matter of scaling up nationally. And our insurance is tax funded, which allows us to capture the informal sector and the poor. So we think we're making good progress, and hopefully in the next few years we can report back to you the success we have achieved. Thank you.
Thank you so much, and congratulations. Yes, so we've had 2 really encouraging examples, and I'd like to reflect back the importance of tracking whether you're going in the direction you intended with your policies and reporting back. It's a really important part of the implementation process. One more person want to say anything? We've had 2 from Africa. No one else? Okay. Well, we can always come back a bit later. Let us move to the second question to you all. Can you read it? You're easier than me. Oh, here it is. In the next 2 years, do you think your country can make significant progress on enhancing financial protection? We've actually had an example from Ghana that they're already doing that, but we can come back to it in more depth. That's interesting. Not so obvious, actually, I would say, whereas the first one on coverage was more equal, yes and no's. This is a rather more, slightly more unconfident group around the no's. So let's, for the sake, I think it would be interesting to hear from the yeses about how they think. We've heard a little bit from Ghana already on the extending the insurance to the informal sector. But can the yeses put up their hands again? See, let me see. And let's see, so there's somebody there at the front. Only one yes? One, very few. Okay, so I'm going to ask both of you if you'd like to say how. Okay, you got a mic? So
Hi.
How are you going to make progress? Give you a stand up, sir.
Sure. My name's Pong, and I'm actually from the private sector in Thailand. So I'm probably one of the 3 that voted up here, saying that we're from the private sector. We are actually very passionate about healthcare. So the organization I came from is called Bridge Asia. And we got into healthcare 3 years ago, helping Srivihok Hospital, the largest teaching hospital in Thailand, transform. It's a 3 million outpatient hospital. It has 100,000 over inpatients every year. All of us from our team, we come from, I guess, from the private payer background, and we always experience the private hospital experience. So when we got there, we saw how hard the nurses, the doctors were working. And also, we also believe that the number of patients that Srivihok is taking care of every year can be avoided if we have a more systematic and better structured healthcare system. So ultimately, we believe that there are many initiatives that can be done. And actually, one of the things about enhancing financial protection, we believe, is really about having more transparency in the system, like what Dr. Wirod mentioned up there. If we understand where the resources, which are clearly limited in terms of people, in terms of money, in terms of other supplies, if we know where they're going, how they're being used, we believe that we can actually drive efficiencies in the system. And through that, we can actually leverage the NHSO fund to provide a better financial protection for people, which we believe ultimately healthcare is a basic right, and everyone is entitled to it. And kudos to the colleague from, our MP colleague from Kenya. We believe very strongly that we need to build not only the existing healthcare workforce, but also a future-proof workforce that understands the importance of health informatics, nurse informatics, and is able to help support value-driven care. So we're very passionate about this, and this is a commitment that we as a firm is willing to commit for the next 15 years.
Thank you very much. There was somebody else who, there were a few people who put up their hands. There was someone over here, I can't see. Yes, would you like to say, sir, how you think the concrete actions to be taken to accelerate progress on financial protection from your own personal point of view, your country?
Yeah. My name is Mtobile. I'm from South Africa, and I work for the government services. I think I'm going to take the perspective of our country. I think it's true that every country should start where it is. The key issue on our side is that we have a kind of a duality of poor quality in public services, high cost of health services in private sector. And really, if we mix these two and try and get a middle ground where we are actually able to give everyone quality healthcare services and being able to include everyone, we could move and make a big difference. I think the opportunities lies in a number of areas. One of them is really task shifting, human resource task shifting. I think more people can do more than we're actually using them now. The second one is really the use of technologies to really drive some of the costs down. But I think ultimately the choices we want to make is that we should really be picking up all those things that work very well. And there's been an evidence that they work, they've got high impact, and really create a political will to do so. Thank you.
Thank you so much. So in the interest of time, let's move to the third question. But note this, twice as many people thought there'd be less progress on financial protection. I think it's a big message to the conference. Let's go to the third one. Now, this is always a big, thorny question. In the next 2 years, do you think your country can move towards better governance for UHC? And we heard some discussions with illustrations of what we mean by better governance. It's not only about corruption, it's also about vision and engagement. But let us see. And I'm going to ask how, for those of you that say yes. Give us some practical examples. Okay. Well, this is quite encouraging. More encouraging than financial protection. Oh, maybe not. It's changing. It's very close. Okay. Thanks, everyone. You're so quick at this. Okay, hands up the yeses. Hands up the yeses. Okay, so Ahmad, over here, middle, mic in the middle. Lady in, no? Yes, go on. Don't be deterred. Don't be scared to put up your hand. If you don't want to speak, you don't have to. But the more people we can say. So, how?
No, I just wasn't going to because I'm not from a low middle income country and I'd rather hear from them, that's all. So thinking about the countries that I work with, about 5 of them I think that the development, Mark referred to the development of national health insurance, and I actually think that's providing opportunities. People are talking about governance arrangements more because of that split between purchaser and ministries of health often. What are the various roles? And I think some of the difficulties of the how are actually producing positive conversations about what those structures and governance arrangements should look like. And I think a lot of countries are talking to each other about what things have they got right, what mistakes have they made, and what can we learn from. And I think that that's all very positive in the direction of governance.
Thanks so much. And the gentleman over here, yes.
Yeah, so I'm Narayan from India, and as you're not giving the chance to other side, no one's, so I raise hand for yes, but I'm speaking about no. So, So
the no's have it.
Yeah. So my point is we're talking about the governance, and as we know, I'm talking in context of India especially.
Yeah.
So the private sector is increasing day by day, and recently in our budget came yesterday, and they have mostly promoted private partnership with on the public fund. So, and the private party is so dominated and so powerful in the position, though even they are influencing the policymakers. And their main agenda is to earn revenue and profit, not to serve. And the existing studies are showing that they have a huge number of out-of-pocket expenditure across the most developed state in India, that is Tamil Nadu. So if we are talking about the governance in context to public-private partnership, the answer is clear no and a big no.
Okay. Thank you. And thank you for being creative about finding a way to speak when you weren't obviously there. I mean, I suppose the big question is there anybody here who's got ideas on how to turn the no's to yes? We haven't heard much from civil society so far. 2 hands. Okay, yes, sir. Please.
Thank you. So I will try how to turn no to yes. My name is Jean-Claude Mugunga. I work for Partners in Health, and I'm giving an example of countries like poor countries like Sierra Leone, but also that are rich in resources and other things. So to turn the nose from the first question on the coverage, second question on and even on the governance, we need to include things beyond health. We need to include fair trade so that these countries can retain more resources and invest those in health. So right now, this question, I was discussing it with my friend Fode in the Kono district of Sierra Leone. For those who don't know it, it's one of the world's largest mining district of diamond. But they've got no surgeon, nobody to do any basic life-saving surgery in a district of more than 500,000 people. So the country as a whole has 200 doctors. You can all imagine that means if you look at all of the resources we are talking about. So in terms of having UHC, for them includes medical schools, things like not just health promotion. Some countries can just open the door, like Canada and others, they'll talk about health promotion, but some other countries we are talking about infrastructure, training midwives and nurses, and doing that. That will require a lot of resource retention, not just resource mobilization, and that will include the World Trade Organization to help keep resources inside, the taxes that evade the countries, things like that. Thank you so much.
Thank you. Yes, last intervention.
Is it on?
Yes.
Bridget Lloyd from People's Health Movement Global, as well as People's Health Movement in South Africa. So Mark spoke about the outsourcing of services to the private sector. This can only be a very temporary role. The public sector has to be built. The GPs are not in the areas which are under-resourced, so they aren't in the rural areas, or they're very scarce in the rural areas, as well as the outlying informal settlements. We also have to look at alternative models of human resources. We can't just outsource to GPs, which are effectively private. We have to look at how do we get more resources to those areas. What about community health workers, mid-level workers? looking at, instead of individual healthcare, we need to look at the whole area and how do we provide specialty care as well as the primary level care to those areas. And also, we need to include the social determinants of health. So we start shifting the patterns of health by looking at prevention, promotion, intersectoral collaboration. Without that, I think we're going to continue saying the same things.
Thank you very much. I'm struck how much human resources are coming up in different shapes and forms during this discussion. Okay, we've got a short session and we are getting close to our limit. So is there any other burning contribution on the how to move on the governance issue? If not, what I'd like to do, can't see any at the minute, I'd like to turn to the panel for some very last reflections on the most important message they've heard on actions and how to make things move faster. I'm going to start, if I may, with the furthest person away from me, the ambassador from Thailand. Any quick comments on the most important?
My most important, I heard that many participants mention about the issue of the money, about the budget. This one is very important. But we have to make sure that the right money is injected to the right place. This thing is very important and supported by the highly skilled and well-trained health workforce. Increase of budget is not as important as efficient use of budget. Why we maximizing the goals? I think this one is important. It's not the big amount of budget, but how we going to use the budget wisely. In the case of Thailand, during the past 8 years, we have survived through the 8 consecutive government for the, we pushed for the universal health coverage. But there is a bigger story that came before we even achieved USC in the year 2002. And the people who push hard and work day and night for years for this to happen must be commended. And I mention this thing because some of them are in this very room for that success back to the year 2002. So we have to keep, as I mentioned earlier, that we have to keep political momentum. We have to connect to the policy makers. We have to connect to the parliamentarians. And then we have to create the partnership. The most important, one of the most important factors is that we have to have the people ownership. People ownership is, I think, one of the most important factors to make this happen. If people don't feel that they have the important part in this policy, it's not going to be success.
Thank you very much. Chieko.
Okay, thank you. Well, I still think that the investment in human resources is very important, but I like the idea, if I pick the idea from floor, that I like the idea from, I think the colleague from Ghana said that introducing the insurance scheme also introduced the transparency of the governance. Thank you.
Mark, typing away, have I caught you out?
Thanks very much. Just reflecting on some of the mixed votes, and that, in fact, I think we've seen tremendous improvements in many health indicators like child mortality over the past 20 years globally, like really huge improvements. The health expenditure is increasing, as we saw in the December report, and interestingly also on the UHC coverage index, and I'm seeing the latest report really just published, the UHC score going up in many countries. So I think we are making progress. I think it's really important to realize that it's not just important people who make progress on UHC. It's really a sense of agency in each and every person about, that we have power to try to make change. And several people have made the point in this conference that in many countries, the move to UHC didn't happen because they were rich. It happened because actually there was a sense that we are poor or we are in crisis, we have to have UHC. So And in several of the countries we've seen here, I mean, I think we've seen really tremendous progress over the past few years, which is actually really providing a lesson, even in poorer countries. Several poorer countries here, we've seen really tremendous pressure, which is progress, which is inspiring.
Yes, I would very much agree. Ambassador, last word.
Since I'm the last speaker, reflecting not only what was just put from the audience, but also the previous session and in general the conference, here we have mostly like-minded society,
Yes. Yeah.
of course, and this is great. But I must say that when we talk about UHC, and in general health, it's not a standalone issue, of course. And throughout the conference, several issues were mentioned, like inequalities, TRIPS agreement, transfer of technologies, gender, youth. All these were contentious issues when we were negotiating the political declaration, but we managed to seal it. And health is part of 1 out of 17 SDGs. And if we want really to make a progress, we cannot make progress only on SDG 3 or only on universal health coverage unless we have similar progress in other related areas. And all of them are really related when we talk about hunger, when we talk about education. We need workforce. Where do this workforce would come from? Of course, there is education. The governance. The governance is the key. So in short, to me, to achieve progress and what's next is similar to what we need to do across the board with regard to every single sustainable goal. It starts with the government, because we need government to translate the best policies or best recommendations that come from the world community into national action plans. The second, of course, obviously, is funding. Now, funding is always an issue, and there is no such government that will have adequate funding for everything, because there are so many things. That's where we need to bring in public-private partnerships, because money is in the private sector. And we've seen some wonderful examples, including the opening session of this conference, how how that kind of partnership and private sector helped. For instance, eradication of hepatitis C in my country, Georgia, is through that involvement of private sector. And last but not the least, and probably the most important, is the civil society. Because when we talk about the government, and of course we mean responsible government will heed to what the public wants. And that's where the civil society and their demand comes. And it is the decision of the society what kind of society we want to live in. We want to live in the society of individualists, where I'm a great baker and I put a price on my bread, which is horrendously expensive, but you take it or leave it because I'm the best. And same goes for a doctor, for instance, or the medical institution which provides the best care. Or we want to live in a society where we care, in a society that has more compassion and more solidarity.
Thank you very much. And to be honest, I think that's a great summary. And I'm conscious that we've come to the end of our time. I want to thank you all. I think it's been great that we've heard from the private sector, from parliamentarians, from civil society, from government, and from academia in this discussion. And with that, I conclude. I'm not going to summarize because I think you gave a very nice overview. I call this session to a close.